Gaza's hospitals are overwhelmed with patients suffering from COVID-19. The World Health Organization has warned that the healthcare system there may collapse. For more than a month, Israel's national vaccine campaign has excluded 2.5 million Palestinians living in the occupied West Bank and the Gaza Strip. The Israeli government said on Sunday it will transfer 5,000 vaccine doses to Palestinian medical workers.
This isn't, of course, the only component of apartheid in Israeli treatment of Palestinians, but it's the latest iteration. Israel is obligated under international law, under the Geneva Conventions, Article 56 requires it to provide all the materials needed for public health and specifically preventive measures to combat the spread of contagious diseases and epidemics, exactly what we're facing here.
Israel's vaccine rollout has been the fastest in the world. More than a quarter of the country's 9 million people have received at least one dose of the Pfizer jab. But the Palestinian Authority has had to try to source vaccines itself, as well as use the United Nations COVAX scheme for developing countries. Human Rights Watch has called on Israel to carry out its responsibilities and obligations under international human rights law. Israel's vaccination program has received international criticism from the UN and world leaders.
I mean, the Israelis have had a very successful rollout of the vaccine. However, the Palestinians have not. Well, if you look at the connectivity of the Israeli-Palestinian people, you can't vaccine one part of your society and not the other and think that you're going to be safe.
Israel's rollout reflects global inequality in access to vaccines. Some countries have ordered more than they need, others none at all. Israel has now extended its vaccination program to adults aged 35 and older. Most Palestinians have no way of knowing when they'll feel the same sense of relief. Barbara Angopa, Al Jazeera.